If you're a billionaire in the United States, you benefited from this country. We owe something back to society.
Unless the rich countries stay generous, then the progress is going to stop and may even go into reverse.
Over 1 billion children have been vaccinated. We've cut the childhood death rate, came down in half.
The Gates Foundation is one of the world's biggest, richest, most influential private philanthropic organizations. It prides itself on being practical, asking questions others weren't asking, and creating solutions.
How can a disease that kills millions of children have so few people involved in it?
The basic criticism is they're too big and powerful.
The Gates Foundation has decided that we will commit to spending $200 billion over the next 20 years. We will then close our doors.
So with the U.S. and other countries increasingly pulling back on foreign aid,
Trust takes a long time to build, but you can take it away so quickly.
can the Gates Foundation achieve their lofty goals over the next 20 years?
You know, at the end of the 20 years, there will be many other rich people.
The vast majority of those resources were to go back to society.
The Gates Foundation will shut its doors in 20 years. Since the pandemic, foreign aid from governments of rich countries has been declining, and that's the base on which private philanthropy builds. Our biggest question, will philanthropy be able to function with a weakening infrastructure? Bill Gates and the foundation have made a huge pledge of $200 billion, but will that pledge go the distance?
I mean, I think sort of conveying the scale of this is one of the big challenges. Like, how do we get across how momentous this decision is? I mean, it almost seems like a kind of tech mindset, right? Like, it's like they're 10xing it. Probably a legacy of Bill's background.
The total devotion to data,
Yeah.
which he had to have developed because nobody else in the world was developing it.
It's the idea of doing something that hasn't ever been done before or seen before.
Right.
Yeah.
We've always believed in having a limited lifetime, but we've actually now made it specifically 20 years that we'll spend all of our resources. And so between the additional money that I'll put into the foundation and the money that's there, over these next 20 years, we'll spend a bit over $200 billion. And so we'll be able to spend at a pretty high rate, and that'll give us a chance to make a great deal of progress, we think, on the key issues.
I'm not aware of any significant foundation that has named an end date 20 years in the future. And the other thing that I think is unprecedented is simply the amount that you will have disbursed. Is that correct?
There have been spend down foundations. Most of the largest have had sort of indefinite timeframes. Rockefeller Foundation and others, were created a long time ago, and they're still doing great work. So for a foundation our size, this is unique. Yeah. And yes, it sets some records in terms of the amounts involved. Other people could later beat it. I hope they do.
So you mentioned the Rockefeller Foundation, there's the Carnegie Foundation, both over 100 years old, and still, as you say, giving money to worthy causes. So why not do that?
Well, the Gates Foundation is fairly operational. That is, we built teams that are experts on malnutrition, malaria, contraception, and we fund both the research to create new products and get them to be very inexpensive, and then we partner with governments and other philanthropies to actually deliver those to where they're most needed. By spending the money sooner than later, it allows us to be very ambitious about getting polio eradication done. We hope in this time frame that malaria is either done or almost done. And we can kind of clarify, okay, here's what we've got, and say to other people, okay, we can't do these other things, so let's work together. Because certainly both of our key areas, health and education, our resources are nowhere near enough to achieve what everybody should want the world to do.
Would it be fair to say that the foundation is very data-driven?
Yeah, we're very data driven. I mean, what other way is there to be? I mean, you know.
Well, but maybe others don't do it as much as you do, or so I have heard.
Sure, but you don't need everyone to go off and do the analysis. But, you know, when I was asking in the late 90s, what do children die of? You know, there were only sketchy answers.
Before the Gates Foundation, many public health decisions were based on educated guesses. That led Gates to spend $75 million in 2015 to start CHAMPS, a global network to accurately map the causes of death in children under 5. That information helps organizations like Gavi, also a Gates partner, to assess vaccination needs worldwide. But 90% of Gavi funding has come from governments.
If you think about philanthropy, philanthropy is a catalytic wedge sitting alongside business, government, and civil society.
We were writing about the 25th anniversary and this big announcement, but now we're also writing about whether or not the Gates Foundation can really fill the gap that foreign aid is now diminishing.
And people would be surprised, I think, that even the Gates Foundation, even one of the richest people on this planet, isn't rich enough to do everything that needs doing to get these vaccines where they need to be.
When I was in South Africa traveling for the story, it was actually the same week that President Trump announced that he was going to be dismantling USAID. We're going to the Desmond Tutu Foundation to learn all about HIV prevention methods in the community. I got to see firsthand where the Gates money goes and speak with some of the recipients of the funding on the challenges they face ahead. When we were seeing these clinics in a certain village right outside of Cape Town, they were saying we would never go to a clinic that had HIV right on the sign, and that it's so important to think about how delivery is done to break some of those stigmas. Another thing the foundation is up against is growing health misinformation and vaccine skepticism. It's so much more than just the production of the vaccine, because there's tons of community work that goes into building trust. I am here in Paarl, South Africa. This research center has a huge youth initiative component. When the global health ecosystem is so complex, it makes it clear just how much eradicating HIV, malaria, and TB will cost. People, when they see the Gates Foundation, I don't think they understand the nuance of the scale of ambition.
This is actually a sculptural exhibit in honor of Bill Gates Sr., our chairman emeritus, really in many ways the heart and soul of the foundation. He helped start it, helped drive it through his lifetime. And he passed away 5 years ago, and actually during the COVID pandemic, this sculpture was put up in place and was awaiting everyone when we came back to the offices. And it symbolizes Bill Sr. is indeed the lead crane, and taking us towards the future, the aspirational future of the foundation. We think, based on the lessons we've learned over the last 25 years of the foundation, that we can make a transformative impact over these 2 decades. Tuberculosis, HIV, and malaria make up the 3 largest infectious disease killers that disproportionately affect poor countries. And we'd love to see a world where all of those are eradicated. But we understand for both tuberculosis and HIV, it likely will be a bit more of a stretch. By the deadline that we're giving ourselves of what can we do by 2045, I think our hope is more that we can control those diseases and bring mortality and incidence rates down in low-income countries to where they are in a country like the United States today.
And so this gets to what I think is the central question for the foundation, or any foundation, which is, okay, you have a wonderful goal. There are a million ways to reach it, and you have to decide what's the best way. What has been the way you've done that so far?
What is the appropriate role of philanthropic capital as opposed to private or public capital? It's a very specific, it's tax privileged, it's an advantage thing. How can it be put to its best use? And the first thing is it should never substitute for either public or private capital. It should be looking to fill the gaps that either those forms of capital won't fill. An example would be, and one of the big examples is in research and development and innovation for many of the diseases that disproportionately impact the poorest. Malaria is often a classic example of that, but global malaria research and development is a fraction of what it could and should be given that mortality volume. And yet we're able to come in and be extremely large catalytic funders in that space, working with the private sector, because we work with private sector partners, pharmaceutical companies and others, to catalyze the innovation the private sector provides, and then working with the public sector, government, multilaterals, to help deliver those services.
As with malaria, the Gates Foundation saw an opportunity with tuberculosis, a preventable disease that killed more than 1.3 million people in 2023. The foundation responded by funding a vaccine accelerator program that could help lower the cost of the vaccine. But as vaccination rates fall around the world, the Gates Foundation will need to do much on-the-ground work to get results.
I still think a large part of the story is still the future of philanthropy and the urgency we're seeing right now. Because right now we're sitting down and we're thinking about the threats we're seeing to foreign aid and how the private sector plays a role. So I think we're trying to sort of balance the reflections of the last 25 years and what this means going forward. What would you say is the foundation's most impactful achievement?
I will say there are many, but I would say the fact that, because of this global alliance for vaccines and immunizations that we were part of founding, there are literally children alive because of that program. It touched over 1 billion children have been vaccinated. And, we've cut the childhood death rate, came down in half, since the beginning of that. So when I go around the world and I meet mothers and fathers, they walk miles for their kids, or they save up the bus fare to get those life-saving vaccines.
What have you learned about how the world's most fortunate should be giving back?
Well, I've always believed, to whom much is given, much is expected. And so anyone who is lucky enough to be wealthy in society, like I'm unbelievably privileged to have the resources I have, but anyone who has resources has something to give back, right? And we should. And even if you don't have great means, if you have a little bit, you can still give back your time. You can tutor a child, you can work in a soup kitchen, you can give away clothes and things you don't need anymore, or buy a Christmas present or a birthday present for a kid who's, in a homeless shelter. I've learned so much from philanthropy, but it's more and more reinforced for me that we ought to do more. We ought to do more for our fellow neighbors.
And so in your perspective, there is this moral responsibility for billionaires in this day and age.
Yeah, look, if you're a billionaire, let's just say if you're a billionaire in the United States, you benefited from this country. You benefited from good roads. You probably benefited somewhere along the way from the health sector, I hope. You probably benefited because maybe it was a good business climate and you could start your business, right? People in other places don't have those things. And so, yes, we owe something back to society. And there are lots of ways to do it. You don't have to do it in any one way. But sure, we were lucky.
So we're talking a lot about progress around global health, but I'd sort of be remiss to not ask about some of the threats that we're currently seeing facing global health policy today. The new administration nearly immediately is trying to dismantle USAID. What was your reaction to this?
Lives have been saved because of the grants from USAID, and it will be devastating what will happen in some of these communities. The U.S. has built up lots of infrastructure around the world, labs for things, making sure there are nurses trained or midwives trained, but we have infrastructure out there, so we're going to pull back and let all of that crumble. And I'm not saying the organization was perfect. Yes, there were some things that need to be looked at. Yes, there probably were some trimming that needed to happen. But what I know and what I have seen on the ground are mothers and fathers who benefit from that. And guess what? If they can prosper in their own community, if they can have good health, their kids can have good health, and by and large, most of them are farmers, they can feed their family, they're going to stay where they are. People don't want continuous handouts. They want to be able to have their own income. So if they can get seeds and plant their farm and get a good yield of their crop, feed their children, put a little bit on the market, they're grateful. But if we now just suddenly in a big whoosh, pull back on that, can you imagine what they're going to think about the Americans and American government? Trust takes a long time to build, but you can take it away so quickly. And I think we need to be much more careful as a nation.
Unless the rich countries stay generous, then the progress is going to stop and may even go into reverse. And so, telling these voters, hey, you should be proud of this, it is moral, it serves a lot of benefits, I'll be doing my best to articulate that. That uncertainty means that how much we'll achieve in the next 20 years, that's probably the biggest unknown, is do our fellow travelers stay generous, or do they kind of tune out these millions of deaths and turn inward?